Hi, I'm Russ Romano. I want to spend a few minutes to talk to you about concussion education. Concussion in sport is a very important topic that has received a great deal of attention in recent years. It is imperative that the medical staff, student athletes, parents, coaches, and administration stay current with scientific literature, consensus statements, and understand the NCAA and USC policies regarding head injury. Under the direction of team neurosurgeon Charles Liu, MD, PhD, USC has been at the forefront in developing a comprehensive program for the evaluation and management of concussions. The USC Athletics Head Injury Program and Concussion Management Plan is on file within the athletic department. The policy is carefully followed, discussed each year at our annual meeting, and is revised after careful evaluation of meaningful research. The information we will provide in this video incorporates our review of the recent medical research on the prevention, detection, treatment, and long-term impacts of head injuries. The 2012 Sports Medicine Handbook referenced a study that gave an estimate of 1.6 to 3.8 million sport-related concussions occur every year. The NCAA has identified certain sports in which student athletes face a higher risk of concussion. At USC, the high-risk sports are football, baseball, basketball, diving, lacrosse, pole vault, soccer, volleyball, and water polo. But student athletes should keep in mind that concussions can happen in lower risk sports as well, or during a non-sports activity such as falling off a bike. Concussions are traumatic brain injuries that range from mild to severe. You can have a concussion without being knocked out, and even a hit or a jolt that does not seem severe can cause brain injury. Concussions can happen during drills, practice, or games, and ones that occur during practice can be just as serious as those that happen during games. The USC medical staff treats seriously all concussions and all signs and symptoms of concussions. Concussions come with many possible signs and symptoms. It is important that you recognize these signs and symptoms and report these immediately. Symptoms may be subtle and can last for days, weeks, or even longer. The following are common symptoms caused by head injuries. While someone with a head injury would not have all or even most of these symptoms, any of these symptoms could indicate a head injury and must be reported to the USC medical staff. The common signs and symptoms of concussion are loss of consciousness, confusion, disorientation, delayed verbal and motor responses, inability to focus, vacant stare, slurred, incoherent speech, headache, nausea, vomiting, balance problems or dizziness, fatigue, trouble falling asleep, sleeping more than usual, drowsiness, sensitivity to light and noise, sadness, nervousness, numbness and tingling, feeling slowed down, feeling in a fog, difficulty concentrating, difficulty remembering, stiff neck, difficulty walking, speaking, or using your arms, convulsions, or unusual or erratic behavior. Again, NCAA and USC rules require student athletes to report any of these signs and symptoms to their medical staff immediately. It is extremely important that student athletes be truthful about their symptoms and follow the treatment instructions of USC medical staff. Do not try to diagnose or treat your symptoms yourself, and do not continue athletic activity until authorized to do so by a team physician or their designee. If you notice these signs or symptoms in another student athlete, tell the USC medical staff immediately. NCAA and USC rules state that anyone diagnosed with a concussion during practice or a game cannot return to play for the remainder of that day. While recovering, you should avoid alcohol, video games, texting, watching television, or any activity that worsens your symptoms. Communicate your symptoms to the medical staff immediately. They need to be assessed each day by the medical staff, and cognitive, balance, and neuropsychological tests need to return to baseline before you can return to play. USC Athletic Medicine conducts baseline testing on each student athlete before they first play in the high-risk sports. These baseline scores are compared to the scores collected following the concussion to assist team physicians in evaluating the student athlete's recovery. The medical staff will advise the student athlete on how to progress in exercise while recovering. The return to sport decision resides with the team physician or their designee. Research shows that the majority of concussions, 80 to 90%, can take at least 7 to 10 days to resolve. There are some people who take longer for symptoms to resolve. While your brain is healing, you are at heightened risk for another concussion. Repeated brain injuries, even if mild, can result in catastrophic injury if they occur within a short period of time. And recent research even suggests that repeated mild concussions occurring over a longer period of time might result in cumulative neurologic and cognitive problems, possibly including chronic traumatic encephalopathy, called CTE, a serious condition. Therefore, while exhibiting symptoms, student athletes are not permitted to engage in sports activity and are required to rest. The USC Athletic Department does everything it can to minimize your risk for concussion. The coaches play an important role in teaching the student athletes proper technique. Drills in practice emphasize safe fundamentals of the game. The equipment staff selects protective equipment like football helmets and attempts to get the best fit possible. And although you cannot completely eliminate the risk of concussion, you play an important role in reducing the risk of concussion by using proper equipment, including personal protective equipment at all times, by playing within the rules of your game, by choosing a style of play that reduces the risk of impacts to your head, and by immediately reporting signs and symptoms of concussion to the USC medical staff and follow their treatment instructions. Even with all of these protective mechanisms in place, the risk of head injury cannot be eliminated. These risks can be short-term, such as bleeding in the brain and paralysis, and long-term, such as Alzheimer's disease, Parkinson's disease, and brain disorders that become more prevalent with age and death. Concussions can also cause brain changes affecting physical abilities, such as extremity function and headaches, thinking abilities, such as memory and reasoning, sensation abilities, such as touch, taste, and smell, language skills, such as communications, expressions, and understanding, and emotional traits, such as depression, anxiety, personality changes, and aggression, and social inappropriateness. Ongoing research is investigating repeated brain injuries and the risks of depression, CTE, memory problems, and early dementia. I hope you found this video informative. If you have any questions or concerns at any time, contact your staff athletic trainer or team physician. As a reminder, you need to be informed about the signs and symptoms of concussions, and you are required by the NCAA and USC to report these immediately and follow the guidelines that the medical staff explains to you. After viewing this video, student athletes who participate in a sport with higher risk for concussions will be asked to acknowledge that they have received the information about the signs and symptoms of concussions and that they accept the responsibility to report such signs and symptoms and concussion-related injuries and illnesses to the USC athletic medicine staff.